Communities are facing a mental health crisis that began well before COVID-19. The pressures of social media, bullying, and struggling to fit in, combined with the lingering effects of the pandemic, have made our children and teens particularly vulnerable. Today, we're going to speak with experts from our associated agencies about the programs our community has put in place to support our kids and teens and provide them with tools to cope when life gets difficult. I'm here with Brittany Barcase, health educator for Jewish Community Services. Would you please tell us some of the trends you're seeing with mental health?
In the last few years, I've seen an increased need in just needing to have more discussion about mental health, understanding about stress, understanding what anxiety is, understanding what depression is, and really understanding suicide prevention and what that entails, and just being able to know who is more at high risk. Another issue is social media. We're all trying to stay connected on our devices. It's unfortunately created a highlight reel 24/7. It's going to start to change the way we view ourselves. It's going to cause low self-esteem.
I understand JCS has developed some creative school program to address coping skills, and one of them is called Wellness My Way.
Wellness My Way is really the complementary version of our in-person programming, but without all the barriers. The platform has different topics that discuss well-being, substance use, and addiction. It has the feel of a multi-level video game. The student gets to choose where the story goes.
So there's also a program called Be Well.
It provides a lot of skill-building exercises, so understanding truly what a coping skill is. And one of my favorites is the 4-7-8 breath, which I would love to teach you right now. You just take a deep breath in and then exhale, let it out. And then we're going to inhale for 4, 3, 2, 1, then hold your breath. 7, 6, 5, 4, 3, 2, 1, and then exhale 8, 7, 6, 5, 4, 3, 2, 1. Good. That breathing technique is great because it triggers your parasympathetic nervous system. So it's really sending that signal to your brain that says, it's okay.
It's so important talking about these tools and the coping skills. Thanks so much for taking the time. Great work and so important, so really appreciate it. I'm at the Stoller Early Learning Center at the Rosenblum JCC in Owings Mills. How did this collaboration come about?
We're both agencies of the Associated, and we both serve children and their families, so it was just a logical collaboration for us to work together on this partnership. And we identified that the stress and the impact from the pandemic and beyond was really most hurtful for our younger children.
Talk to me about what we can do with preschoolers.
There's a lot. You don't normally think of sending toddlers to therapy in the general sense, but having a support person, we have an embedded social worker as a consultant that's here to help kids that have big feelings. They're being frustrated, they're having issues, to have them right on scene and to be able to give them that caring presence of an authentic relationship with an adult person that they can get comfortable with, to really be able to offer supports to them just when they need them.
You know, it's at this age where there are things that are identified for the first time. We talk about in schools how much in K through 5 kids need support. Well, a lot of times that actually has to be identified in preschool. And I think for young kids, what we saw in camp was the frequency, intensity, and volume of need from mental, emotional, social health. Now we're, 2-3 summers in after the pandemic, but now we're actually talking about it. And now that we're talking about it, we need to be prepared to deal with it.
I want you to think of perhaps an example you could give me of how this support staff now helps both campers and staff.
So when we're able to get information from a family, we can create a plan in advance. When our camper staff member starts before the summer, they read the profiles. If they identify something in one of the profiles that they think that they could actually do something before the camper comes, they'll reach out to the family to say, hey, can you give me a little bit more information? Is there something in school that's working that we could do here right when they start? So it's not even, we're setting them up for success from the get-go. Then it's actually meeting with the staff member before camp starts to say, okay, this is the plan that's going to be put in place for this child, so that way we're we're starting from a place of prevention as opposed to reaction.
Well, thank you both so much for sharing this with me and for the work you do.
Thank you for having us.
I'm here with Diana Solomon, Senior Director of Forefront. Have you seen more teens in recent years struggling with mental health?
Adolescent mental health has always been an issue nationally and even globally, and it's definitely something that has been on the rise in the past few years, particularly because of COVID and everything that teens have had to go through over the past few years.
So I know you have a peer leadership program.
One of our teen signature programs is called the Peer Leadership Fellows. In this program, teens are really learning how to engage their peers in ongoing, meaningful, identity-based conversations so that they can have a touch point in the Jewish community and feel really more connected to the Jewish community. We also felt that it was important for them to be equipped in listening out for their peers' well-being and mental health.
How are the fellows actually trained?
The peers participated in a 2-hour training that was created by Be Well, which is an organization that focuses on mental health through JFNA. Teens were trained on what is mental health, what is resiliency, what are some of the signs and symptoms of somebody who is struggling with different mental health disorders, and then really what is their role in first being an observer, being the person to maybe take note of some signs or symptoms or changes with their peers, and then when and who do they go to if they do observe something. We know that they're not a trained professional, but they are someone who's gonna talk to their friends in a safe space and then to know what to do with it next.
Do you have perhaps a story of how something went just so beautifully, a real example that you could share?
Several of those teens have reported back that they are noticing things and they're more aware of it in a way that they weren't before. Whether it's peers struggling with lack of sleep, falling asleep in class, not sleeping at night, they didn't realize that that could be a sign of a mental health disorder.
What about programs for parents of the teens?
Forefront very much acknowledges that parents are part of this equation. Forefront has a platform called Parenting Unpacked, which offers different workshops, series, education for parents of teens, and a lot of those programs tend to be geared towards mental health. So we try to help them with tools using different speakers or trainers that we have relationships with.
Well, thank you. Thanks for shedding some light and keep up the work. Obviously, it's something to really be proud of.
Thank you. Thanks so much for having me.
In addition to these wonderful programs, we want you to know that the Associated and its agencies are here to address mental health challenges for you and your loved ones. Go to associated.org/mental health to learn what's available in our system.